Good morning, Mrs. Merriweather. Good morning, Sam. It is great to see you again. How have things been? Any pain lately?
Well, Dr. Fifi, Sam has had some pain when we first moved here and we went to the emergency room. He has been doing a little better and taking his medications.
Sam? How have you been doing?
Sure, whatever my mom said.
Okay. Let's get your monthly exam going then. What medications are you currently taking?
Well, he takes ibuprofen, Felic, Hydrea, and hydrocodone.
Okay. Sam, do you know how much of each medicine you take?
What did you say, doctor? I was on my phone.
That seems to be a big problem for you today. Your phone, I mean. I asked if you know the dose of your medicines.
No, why do I need to know that? My mom gives me what I need to take and I just take it.
Sam, you are getting older, and it is time that you start learning more about your sickle cell disease and taking more responsibility for your health. So, Mom and Sam, my prescription for Sam and your family is to attend our sickle cell teen clinic so that the family can learn about how important it is for Sam to be more independent with his sickle cell disease.
Thank you all for coming to teen clinic today. As you can see, the teens are in one room and the parents in another.
Why do I need to learn about sickle cell? I know that I have it. What else do I need to know?
That is a great question, Sam. Who can answer that for us?
I can. My older sister who has sickle cell told me that one day we will have to transition from the doctor that we see at the children's hospital to a doctor at an adult hospital.
That is exactly right. It is important for teens with sickle cell disease to learn about their disease, to know more about their bodies and how sickle cell affects them, and to be able to talk to doctors about their health and sickle cell disease without their parents' help, especially since your parents won't be with you all the time when you are older. Before each of you go to your individual clinic rooms, does anyone know what things they can do to practice taking more responsibility for their sickle cell?
I guess know what type of sickle cell that you have.
Great.
You could learn how to call in your medication refills when your meds run out.
You all are on a roll. These are great things that all of you could do to be more independent with your sickle cell care.
My mom said that I should learn how to make my own clinic appointments.
That is another good thing to learn and start to practice. It can be helpful to watch your mom or dad call and make an appointment, and then you can do what they did.
I want to learn how to explain to others that I have sickle cell.
I would never tell anyone that I have sickle cell.
Sometimes we are afraid to tell others because we worry about being treated differently or even bullied. But, we will talk about ways to talk to friends, teachers, and even bosses.
I do not know how this clinic is going to go. I always have my mom or grandmother with me. I don't ever answer any of the doctor's questions myself.
Hi, Sam. How has teen clinic been so far?
It has been okay. It was nice meeting other teens with sickle cell.
Great. So, I am going to ask you some questions that over time and with practice you will be able to answer by yourself about your sickle cell.
Sure, doctor, I will do my best.
What medications do you take? How much of each medicine do you take? How often do you take them? And, why are you taking the medications that you are currently prescribed?
My hematologist just asked me these questions 2 weeks ago. I don't know. I never had to know before because my mom always knows.
That is common with younger children, but you are a teen now. And, we want teen clinic to be where you learn how important it is to know about your sickle cell and be more independent. Don't rely on mom so much, Sam. A couple more questions. Do you know what your blood type is?
Nope. I told ya, doctor, my mom always answers these questions. But now I see that she won't always be here with me.
That is true. But, you still have time to learn about these things. One way is to ask your mom if you can answer some of your doctor's questions during your next visit.
Yeah, I could try doing that. Is it okay to ask my doctor questions if I don't know something?
Of course. Doctors like it when their patients ask questions and want to learn more. Another thing that you could ask your doctor is if you have any antibodies to blood, because these help us know what kind of blood you can have or if you can even have a blood transfusion.
Okay, I can do that. Do you have a pen so I can write all this down?
What, a pen and paper? Are you trying to be old school, Sam? Just kidding. One thing that I have noticed about you is that you always have your cell phone whenever I see you. I think that might be a better way for you to write down questions and information that you learned about your sickle cell.
Yep. You have a point. And there is this cool app on my phone. You can put all of your important medical information.
Great, let's finish your exam.